Jay.
Okay. All right, Commissioner, we're 10 minutes behind, so take off.
Yes, sir, Mr. Chairman, and will be expedient. Thank you again for hearing the 2020 Joint Appropriations Governor's Budget recommendation for the Department of Transportation. We're loading up the presentation. I believe you have handouts. Before we jump right into the budget process, though, I'd just like to reflect a little bit on the great progress made since this time last year, and think about freight and freight mobility a little bit, and I always like to put that in two buckets, moving people and moving freight. And on this slide, you'll see on page 2, you can see down at the middle left is the work on I-16, I-75 in Macon. That's not quite what it looks like today, but that is a rendering to show the $269 million underway in freight mobility to move freight through Macon. And just to remind everybody that we still have 3 more phases to go at a tune of over $300 million. That's that middle left picture. Since we were together last year, we've broke ground on our first MMIP project, which was for freight mobility up Interstate 85 into Barrow, Jackson, and Gwinnett counties. $135 million investment focused on moving freight. In the bottom left on this slide is showing the I-16, I-95 interchange that we're under contract with now, and also widening I-16 down to 516 in Savannah, a design build project with Savannah Mobility Partners, a $260 million investment. Again, just to highlight the freight mobility going on their interstates. On the next page, on slide 4, I believe it is, the express lane progress we've made since this time we were together last year. 10 miles of extension of the I-85 hot express lanes in Gwinnett County, which also included a 3rd lane, general purpose lane to move freight. And of course, our largest and most transformative project that we've ever had, which was the P3 Northwest Corridor up in Cobb and Cherokee counties on I-75 and 575. We have seen tremendous outcome for that, some about 24,000 vehicles per day using express lanes, but has made the general lanes better by some 10 to 15 miles an hour, and also have reduced the time of congestion by over an hour every day for the people that choose to use the express lanes, but the hour a day savings is for the people that are just staying in the general lane. So we're seeing a tremendous outcome from that, as well as the benefit to transit for the buses and the express buses using those express lanes now that have a much faster and reliable trip. So just wanted to highlight that in the form of people mobility. Then over on the next slide, again, just so that we're not just thinking about interstates always, we have to think about all of Georgia as it relates to freight mobility. And this map actually highlights the projects that we have underway. Working with Jay Robertson, the Director of Planning, and his team, as we look out over the next about 9 years, there's $2.3 billion of projects on 5 major corridors. Those are corridors like State Route 133, US 1, State Route 17, US 84, US 441, and US 27. And just to give you some perspective about the investment in rural Georgia that's not on the interstates, right now, what we have under construction and what was completed last year total $730 million of investment. So we have to think about freight globally as a state, interstate as well as rural. And certainly we utilize our freight plan, freight and logistics plan that we have, which is a federal requirement as we figure out how we focus on federal, how we use that federal plan to deliver freight. I'm trying to go fast, talking faster than I go. Let me bring you up to speed on the federal shutdown status, how it impacts transportation. I felt like it was important that the Joint Committee heard this. The federal government and transportation is a reimbursable program, means we spend our dollars first. We send a bill up to Washington, and they send us back 80 cents on the dollar. That's how that generally works. And as you know, the continuing resolution that we're operating on ended on December 21st. Which has given us a reality of about $269 million of funding appropriations to date, out of about $1.2 billion, okay? So the way they do a continuing resolution is they take your total appropriations, $1.23 billion, and divide it by 365, and that's your daily pro rata share. Needless to say, that's hard to deliver transportation projects. Also on the slide is I wanted to show you what we have done to continue to advance transportation in Georgia by doing something that the federal government allows you to do. It's called advance construct, which means you follow the federal process, you get the federal approvals, albeit they don't have federal money to give you, and you can use your state dollars, and the feds will promise to pay you back as soon as they have that. And so we have advanced construct $493 million to date using our state budget capacity. And that brings our total bids to year to date to about $833 million, which means we've paid it forward about as far as we can go using our state budget based on the promise of the federal. So we are indeed needing the continuing resolution or something to happen so that we no longer have project impacts. The project impacts realized thus far was in January. We took $32 million out of our bids in January. For February, which is advertised now for bidding, we took $63 million out. And right now, if nothing changes, March will be $130 million taking out of the bid. So that means we're having to slow down the ability to advance projects to construction when they're ready. Also impacted is the FTA, Federal Transit Administration. They're no longer able to do reimbursements, and this affects especially the rural providers of transit agencies. And that's to a tune of about $3 million a month, of which is normally reimbursed to the local government. So we are now seeing that impact come to fruition, and it also slows down the pipeline of projects. As we do the environmental process, a lot of the federal regulatory agencies are they're not at work, so they can't review the documentation. So I just wanted to bring you up to speed on how that's actually impacting Georgia at the moment. Again, we've tried to do all we can and be effective and as efficient as we can to deliver where we can. Now, moving into this next slide, it says Hurricane Michael, and I just again want to say thank you to the House and Senate for moving our amended 19 budget under the special call session, which gave us the ability to fund and continue to do the cleanup work that's ongoing in South Georgia, where we're cleaning up ourselves, where we've contracted for cleanup. A tremendous amount of work has been done. There's still a tremendous amount of work to be done, but just wanted again, by way of reminder to the Joint Committee, that amended FY19 was addressed in special session. So moving forward, let me jump right into the actual FY 2020 budget request, which totals a little over $2.119 billion. The biggest component of that comes from motor fuel at $1.925 billion. Transportation Funding Act fees totals about $193.5 million. So if you want to follow along on HB 31, that's about page 112 or page 348 on the governor's report. I like to take this chart and sort of lump the programs together in a graphical kind of way that sort of shows where the money's utilized. And that first bucket is capital projects, which constitutes about 48% of our budget, a little over $1.03 billion. That's things for capital construction, for those construction projects, capital maintenance projects, and also local roads, which are dollars that go to the local governments on projects. So that constitutes the biggest part of our budget, is the capital expenditure and maintenance and construction. Next is general operations, which is about 11% of our budget. $228 million. That goes to normal administration, construction administration, which is all the work necessary to get a project out to be built. That's the design, engineering, right-of-way, environmental, survey, all those things. Also includes data collections, planning, and traffic management, all lumped into what we call general operations. Next is the local maintenance improvement grant at 10%, which totals $192.5 million. This is an all-time high, if you recall, that these dollars go back out to our cities and counties based on formula appropriations. And cities and counties are loving this, and again, it's really a benefit for them to see an all-time high in funding in this category. Next is our routine maintenance of just think of preventative maintenance, cutting the grass, picking up the litter, patching potholes, filling cracks, cutting trees, all those kind of things necessary to keep our roadsides and roadways safe. $443.9 million, or 21% of the budget. And I might add that about 50% of that dollar amount is outsourced now, where we outsource that to small contractors to do that type of maintenance, and we're grateful for that. Next category is payments to CERTA at 5%, which is right at $100 million. And let me remind you that in payments to the State Road and Tollway Authority, it's really three major buckets that happens in. One is funding CERTA operations for them to be able to manage the express lanes that we have in place now. Funding the GTIB component of it, that's the Georgia Transportation Infrastructure Bank, and I'm sure Director Tomlinson will talk about that. And then lastly is the debt component. Since CERTA is administratively attached to the department, they handle our federal debt component. So sort of the breakdown of that totals, if you look in your budget book, it totals about $103 million, but part of that we're able to back out some we're able to swap some transportation fees for motor fuel to free up some motor fuel. So it comes out to about $100 million. And then lastly is general obligation debt is at $117 million. So let me take a little bit deeper dive out of those programs. And if on the next slide, and this, again, this will be about page 112 on HB 31 or 348 on the governor's report. Here's the capital maintenance, about a $32.6 million add to the base. Again, this helps us in these times like now where there's no federal fundings that we can continue to advance capital maintenance projects with our state dollars, which is a very big help. Next is department admin, a $1.5 million add to that. This is to help our continued efforts in upgrading our IT support, a lot of database, a lot of federal requirements now on transportation asset management database, and also to cover some audit contract expenses of where we're outsourcing some of our internal audits and for controls. So we need some help with that. Next is the LMIG adjustment, which is based on, again, 10% of the excise collection is how LMIG comes about. And then planning, $200,000 to address match for some additional federal studies and operational study needs from the planning division. Routine maintenance, again, a $976,000 adjustment, again, goes toward our contracting and what we're contracting to do to take care of the roadways and keep them in good condition. And then, as I mentioned before, in payments to CERTA, if you look on this chart on the slide, it's basically a motor fuel to transportation fee swap, so sort of a budget neutral issue there. Now, that's motor fuel and transportation Funding Act fees. Let me move into our intermodal program, which is state general funds. Total request of $18.8 million, which leverages $92 million in federal among the four programs. So in this budget, instructions for this year was the 2% adjustment for merit pay for employment, recruitment, and retention. That comes into about $25,000. Our second priority we had was a $221.8 thousand request for a short line rail bridge program. That is to do an analysis of the 156 bridges that are on the 540 miles of short line rail that the state of Georgia owns. This gives us the ability to take a better asset management based approach instead of just looking at sort of worst first and triaging. This will give us a basis to go with, very similar to how we do our roadway bridges, but we need to get really a good inventory of condition and baseline where our short line class 3 railroad lines are. Also in this was a $121,413 request, which is to help fill some vacancies in our waterway division. As you know, the Savannah Harbor expansion project is really going full tilt now. We're in the meat of it. And I remind you that federally there was about a little over $110 million appropriated in federal fiscal year 19 to continue the work in SHEP. There's a tremendous amount of work going. There's still about $365 million of work outstanding on that project. And we need to make sure we have enough staff and availability as the pure dredging and the more physical things of this project get underway. So that is the request for our intermodal budget, again, state general funds. Lastly, we're very encouraged and thankful for Governor Kemp and his team to include $100 million of bridge bonds. And let me speak about this for a moment. From FY16 through FY19, due to the bond money that has been appropriated, we've delivered 78 bridges that have been replaced, including 17 right-of-way parcels that had to be acquired to replace those bridges. For FY20, out of this $100 million, we look like we can probably do somewhere between 20 to 28 bridges, which would bring our total up to over 100 bridges since FY16. So it's really important to continue to focus on these bridges because the bond money goes to our state-owned bridges, which frees up dollars to where we work on our local bridges, our city, county bridges, and where there's still a tremendous need. There's 200, and let me just going back, when I go back to FY16, it's over about $1 billion that we've been putting into bridges since FY16 as a state, and that's a tremendous amount of dollars and certainly a great outcome for this state because we still have so many to work on. Globally, there's a little over 9% of our bridges are still posted, with 1,335 that are on city or county roads. So there's tremendous backlog that we continue to work on. And again, the $100 million helps us work on our three programs that are locally focused. That's the low impact bridge program of where we use federal dollars to basically close a road, take the bridge out, put it back. Also our local bridge program where through, again, asset-driven approach, our bridge engineers contact cities or counties and say, we'll replace your bridge and all you have to do is put in 50% of the right-of-way cost. We'll design it, we'll buy the right-of-way, we'll fund half the right-of-way, and we'll build it for you. And we do that on, a strategic approach based on the criticality of the bridge. And then lastly, we'll continue to do our design build bundles of where we take 2 or 3 or 4 county bridges, county road bridges or state route bridges, and put them together in one contract and have a designer and a contractor do design build, and they can get the work done a lot quicker. So again, we appreciate the favorable consideration for the $100 million GO bonds for bridge. Mr. Chairman, that concludes my report, and I'll be glad to answer any questions or comments. And I may have broke the speed limit. I apologize if I did.
I think we give you 10 miles an hour, just like
Thank you, sir.
law enforcement does. Representative Taylor.
Thank you, Mr. Chairman. I just wanted to take a moment to thank you and the department for all of the help that we received in South Georgia. I know people have talked about the storm. It was just wonderful to see your folks there helping, clearing the way, helping with the power lines. I know those are things that were above and beyond the normal duties, but it was greatly appreciated and helped us get back together. Thank you.
Thank you for that.
Representative Lucas, or Senator Lucas, pardon me.
Thank you. I thought you were going to demote me, man.
We got you now. We ain't going to send you back. We got you now.
Commissioner, 2 things. I got a resolution sitting on my desk, was in my office this morning, talking about I-14. Can you enlighten me on that? And then the other one is, what is the projected year that 1675 interchange will be finished?
Okay, so 2 questions in that. I-14, there's a lot of interest, and you may see that sort of through the middle part of the state. I-14 as well as I-4 was looked at by the Federal Highway more than a decade ago, and they came to the conclusion that that's not a bad notion to look at including the interstates really for military purposes. But with that, there's no additional funding. So our best answer for that is Fall Line Freeway and basically the completion of that. So that's something we watch. There actually was a national study just completed about the interstate system, of which they did not recommend adding new interstates, but try to put the federal investment back into the existing interstates. There is some momentum around that, and there's a great young man over in Columbus, Georgia, sort of leading that charge, and it's really exciting to see. That's just something, again, Jay from planning and us, we look at. We know that's out there, but we have to spend our dollars where they're most needed first and foremost. Not to say that I-14 or I-4 is not something that deserves consideration. It's just not something that we're working on this day. The second question was, what was the second question? 1675. So we've got 3 phases already underway. The next 3 phases will happen over about the next 5 or 6 years. So this actual sort of start to finish is a 10-year journey. The good thing about that, though, is there's individual wins that the segments of roadway get better as we build it in phases. So there's improvements all the way along the way. When you take a project that's like that, that's so complex and so big, we couldn't bid it in one project. One, the dollar amount was really big, and it's not a super suitable project for some kind of public-private partnership. But it would have been hard for a contractor to price it because it's so long. It's hard to get a price today for something that you may build, 10 years from now. So we broke it into these phases. But it's quite a journey. But the first phase of the restoration of Pleasant Hill neighborhood and community is well underway, and just about all that's completed. But one of the earlier phases, too, which takes the I-16 eastbound traffic in 75 right there around Coliseum Drive, will be a marked improvement because we won't have everybody coming together at one spot. So you'll see some initial benefit out of that.
Representative Knight.
Thank you, Mr. Chairman. Commissioner, thank you for all you do. I know that Georgia's growing and y'all are trying to keep up with the infrastructure growth, and we couldn't do it without you, so thank you for what you're doing. One of the questions I've got is with rail. As we increase rail coming and going from the port, I know there are some of the communities that, and specifically mine, maybe a little help with some of the signals. I know that some of the rail lines and the double stacking are coming and going, and it's, signalization, I know through some of our particularly some of our cities, is backing up at some crucial downtown points, and maybe get with you and see what we could do, because I know we want to continue to get traffic off the highways, but we don't want to stack them up in downtowns either, as those rails. But thank you for what you're doing there. And then one final comment: appreciate you with the aviation and certainly with the new airport project for what you do. And I know as aviation continues to grow in Georgia, that's a very important sector as we look to grow Georgia.
Yeah, thank you. And absolutely, the observation on rail traffic is picking up, which is good. It's good for us because we're getting those containers off the roadways. We've got a great relationship with the Georgia Ports Authority. In fact, in this month's letting, out of the few things we did let, we had 2 projects in Macon that will allow for double stacks so that those projects can get by, and also a very critical project down at the port itself of Pipe Makers Canal to get a bridge up and over a canal, but over the Mason Mega Yard where the GPA is doing the expansion for NS and CSX, so that those trains can loop around and not have to back up into Garden City and to have those kind of impacts. But we'll continue to work, and especially on individually too, on rail crossing safety. That's a federal program that we continue to try to explore. Certainly a need because we'll continue to see freight rail traffic increase. So certainly a good point. Thank you.
Representative Williams.
Thank you, Mr. Chairman. This is, thank you, Commissioner, for what you do. And this is for you or the gentleman from OCILLA, whichever one like to handle it. But the bridge at 84 and 17, or 84 down from 17, the bridge expansions, that leads to the industrial parks there. You've got it on your map. I just wanted a little update on the 84 piece near 17. If that was the one you were referring to. If it's not, then you might want to pencil it in, but go ahead.
All right. Is that the project actively under construction, that 84 and 17, part of the realignment? Maybe I'll just get with you afterwards, make sure I got it. I'm sorry, I don't have it right there in my memory.
It's not right at 84 and 17. It's off of 17. I'm referring to 84 near 95.
Okay.
Let
me give you an IOU and follow up with the status of that.
I appreciate it. I like the interest you pay.
Okay.
Commissioner, I think you arrived at your exit. You'll be able to get off right here. So we thank you so much for what's going on. It's exciting what's going on in Georgia in transportation. We appreciate your leadership. You're doing a great job. Thank you so much.
Thank you very much. Glad to have the exit.
All business. come on up. Thanks a lot. Appreciate it. Yeah. What do y'all do? Open those doors when they all come in and out. Doorkeepers, get the doors open and closed where we can get everybody in and out. Well, ladies and gentlemen, give your attention to Commissioner Berry, Department of Community Health. Commissioner, we're starting you out a little late, so you're going to have to move pretty fast here. So sorry, lost you 10 minutes there. So we are welcome and glad to have you today. Thank you.
Good morning, Chairman Hill and England and members of the committee. Thank you all for being here today. Before I get started, I know we're in a little bit of a time crunch. I certainly wanted to recognize our team at the Department of Community Health for all of the work they're doing on a day in and day out basis, and think they need all the recognition they get. I also wanted to recognize the transition team that we've been working with and now are permanent employees who have been so helpful in getting us prepared. Chief Operating Officer Lori Smith and her deputy Cody Whitlock, CFO Greg Dozier, and OPB Director Kelly Farr, and then Ryan Loke. They have been really helpful over the last week getting us ready for today, and also Teresa McCartney for her help with the transition and getting them prepared. And of course, Tara and Melanie from the House and Senate office have been instrumental. I wanted just to take 2 seconds to talk a little bit about our purpose, shaping the future of a healthy Georgia by improving access and ensuring quality to strengthen the communities we serve. The Department of Community Health wants to be at the table, wants to be helping inform discussions as it relates to overall health care for the state of Georgia and our citizens, and we take that very seriously, and it's an honor to be in the role. This is finishing up 2 years at the Department of Community Health. It has been, of course, the greatest honor you can imagine, and working with the team there has been incredible. I know we have several new members and that are joining us today, and just wanted to give a brief overview of the department. Lisa Walker, our CFO, will get into the actual dollars, and then we'll be able to answer questions. But I wanted to let everybody know we have really 5 major divisions in the department. The Division of Medical Assistance Plans, most people refer to that as Medicaid. The state office, or the State Health Benefit Plan, many of you will know that as SHBP. Healthcare Facility Regulation, that's just a small little piece of work that we do, otherwise known as Certification of Need. And then the State Office of Rural Health, which of course is down in our Cordele office, and we're looking forward to the work that's going on in rural health care. And then health planning, which is the small little office called Certification of Need. I want to remind everybody that there were 61,153 Georgia Medicaid births in 2018. 1.9 million people are enrolled in Georgia Medicaid. 1.3 pregnant women, children, and youth. 519,000 age blind and disabled citizens. 52% of Georgia's children receive medical coverage through DCH. That's a combined through Medicaid and the State Health Benefit Plan. 665,000 state health benefit members receive their benefits from the State Health Benefit Plan. The healthcare facilities regulation oversaw and regulated 24,000 healthcare facilities last year. The State Office of Rural Health administered state and federal funding totaling almost $17 million last year. And last year there were 82 Certificate of Need applications that came through our office. Briefly, before we get into the numbers, I wanted to touch on some of our guiding principles. Communication, we believe that we owe it to ourselves and to our stakeholders to do a better job of communicating. We certainly recognize that there's always room for improvement in that area. Customer service is another big one of ours. We refer to this as CCTA, communication, customer service, teamwork, and accountability. Holding each other accountable inside the department and holding our providers accountable and them holding us accountable. We believe that we can do this all through partnerships, and we continue to push on those. Think moving forward, you'll hear Lisa talk a little bit about the dollar requests that we have in. We believe that there are 5 really key areas that we have significant exposure on. IT infrastructure is one of those, and you'll hear a little bit about that in just a few minutes. We are based on a system that is about 20 to 25 years old, and we need to modernize our IT infrastructure in the department. The Medicaid transformation, our Medicaid system is based on a model that, again, was put in place about 25 years ago, not just the IT infrastructure, but the way that we have people positioned in our department. I'm thrilled that under Blake Fullenwider and Lynette Rhodes' leadership that we're transforming the way we deliver the Medicaid program. Continuous process improvement. What we mean by that is continually looking at ways that we can improve our system. The greatest example on that, for instance, is the Katie Beckett waiver. Years ago, we had a member of the General Assembly who came to us who has a child with a intellectual and developmental disability, and he told us that every year having to reapply for the Katie Beckett waiver was something that put a tremendous amount of stress on families. So we looked at our policies and we were able to change that and go to every 2 years. The relief that that brought to families was something that was greatly appreciated. So we're looking at all of our practices and policies on how to make that a better process. Healthcare analytics and reporting, we believe very strongly that if asked, how do we determine what positions we should take and what positions that we can help you all make, we need to have good, clean data to help with those decisions. So healthcare analytics is another one that we're investing energy and resources in. And finally, I know that there is a tremendous amount of discussion about the Certificate of Need initiative. And I think that the department is prepared to have discussions. We're interested in hearing what recommendations come. We'd like to be a part of the discussion to help inform some of those discussions. We are neutral on what happens. We administer what you all pass. And so we're looking forward to the discussion. And if we can be helpful, we certainly want to be engaged in those discussions. Just wanted to take, again, a few minutes to give an overview of the department. We will be more than happy to meet with any member individually or in small groups to go over in detail a more robust discussion about the department. And I certainly want to recognize you two in particular for all of your support over the years that I've been in this role, and know that we cannot do it without your partnership and your support. So thank you very much. I'm going to turn it over to Lisa to talk about a few of the major budget item requests, and then we can certainly answer any questions that you may have. Lisa?
Good afternoon. I'm going to start by giving a general overview of our fiscal year 2019 budget. Currently, our budget has an appropriation of $15.3 billion of total funds. Of that $3.3 billion of those dollars are state funds that goes forth to fund our programs within the Department of Community Health. 97% of that funding is in the benefits programs, which is Medicaid, Age, Blind, and Disabled, and the Medicaid Low-Income Medicaid program. This pie chart does not represent any of the attached agencies, nor does it represent state health benefit plan because they are not appropriated state dollars but other funds. I'm going to start by going over our budget in terms of our current year amended year request and our fiscal year 2020 request. It's going to be actually separated into two categories, which is departmental administration and program support, and also in terms of our benefit programs. But I start with our departmental administration program support by going over the amended fiscal year first, and then the FY 2020 budget items. The first of those items is background check. DCH is, we have a request, and that amount is for $495,264 for background checks. And that's to implement Senate Bill 406, which provides for increased background checks for long-term care facilities within the state, and that's for the amended year item. The next item is Medicaid Management Information System, which we refer to as MMIS. And that's a request in for the design and build the MMIS system, was just to create modules to help process our claims and financial structure and more subsystems within our agency. And this requires a system refresh to begin around 2020 as part of our 5-year extension plan. The next item is healthcare. Well, that item is $5,696,419. The next item is healthcare facility regulation process improvement, and that amount is $152,500. And that item is to help improve the processes within healthcare facility regulation, with helping automate their schedule assist system, timing system, and also their access database conversion and a new online license application process to help them process and operate in a better fashion. The next item is for external Medicaid consultant of $1 million, and that particular amount is for to review and analyze Medicaid options for the purpose of drafting and preparing waiver policy for recommendation for approval from the governor's office. That concludes the amended fiscal year 2019 for departmental administration. I'll cover the 2020, which is the second column you see before going to the next slide. Background checks is also appropriated in our FY 2020 budget, and that's in the amount of $737,639 to go forth, as previously mentioned, to implement the Senate Bill 406 for background checks at long-term care facilities. A new item in 2020 is for third-party liability, and that's to help procure a third-party vendor to help us actually make sure all payments are made in terms of beneficiaries within Medicaid, because Medicaid is the payer of last resort, to go after those third-party payments regardless of whether they have another health care plan or some other type of health care coverage coming from another area. The last item for Department of Administration program support is the CHIP Enhanced FMAP adjustments for administration. Peach Care FMAP is changed as it relates to the ACA provision. The 23% enhancement goes down to 11.5%. So the FMAP decreases from 100% coverage to 88.52% in terms of fiscal year 2020 for Peach Care related services in our admin budget. The next slide goes into our benefits for age, blind, and disabled, low-income Medicaid, and also for our Peach Care programs. The first of those for amended fiscal year 2019 is for benefits growth of $33,745,829, and that benefit growth is actually contributed to increased utilization, cost in pharmacy, and some general medical inflation trend that we see increasing across the country and within the state of Georgia, and as it relates to trends, demographics, and things of that nature. Medicare Part B is the next item, and that's the item that covers dual eligibility for Medicaid recipients if they're eligible for Medicare and Medicaid. That amount is $1,998,764, and we usually make that adjustment every year because of federal mandates and requirements that comes through CMS. Part D clawback is also related to dual eligibles for their prescription plan, and the coverage for that is also changing as it relates to federal guidelines changing, moving from calendar year 18 from $92.70 to $94.50, and this is just an adjustment to right-size that for the dual eligibles to pay for their additional prescription plans. Gene therapy is an added coverage and service for the Medicaid program. Within gene therapy, those are two actually gene therapy class drugs that's being approved by FDA, and that we will have to add on to our Medicaid for that coverage to be included for beneficiaries to receive gene therapy if they have to use gene therapy. And that dollar amount for amended fiscal year is $5,842,443. IPPS Phase 3, and what IPPS Phase 3 is our inpatient prospective payment system, and that's a methodology in which Medicaid reimburses hospital for inpatient hospital stays, and we're actually proposing to update the reimbursement, which will lessen the impact in terms of a loss to those hospitals who have a large inpatient reimbursement at their particular hospital. And that request is for $4,637,616. The next item is long-term acute care. Long-term acute care, that's an item within our budget that we're requiring to add an additional 8 long-term acute care facilities and 3 intermediate rehabilitation facilities as Medicaid providers to expand coverage for those who are receiving Medicaid funding. And that amount is for $2,504,548. The hospital provider fee payment, there's an adjustment in the hospital provider fee payment because each year we have to do revenue estimates and submit them to the Governor's Office of Planning and Budget based on our projected estimate in terms of what we might receive in terms of hospital provider fee payment. And the estimated is actually a reduction in terms of what we project for receiving less amount for the amended year of $14,535,914. The last item in amended fiscal year is for disproportionate share hospitals, what we refer to as DISH, and that funding is a supplemental payment that goes to hospitals who serve both Medicaid and the uninsured in terms of the indigent care population. And the amount in terms of the request for that particular item is $18,766,884,000. I'm going to move into the fiscal year 2020 column, and most of these items are items with the exception of 2 that I've already covered. So I won't provide an explanation, but I'll go and repeat the number for the federal fiscal year, fiscal year 2020 item. For benefits growth for 2020 is $88,885,270 for fiscal year 2020. For Medicare Part B for 2020 is $6,839,224. For gene therapy for fiscal year 2020 is $5,926,010. For the long IPPS Phase 3 for the change of the reimbursement methodology for fiscal year 2020, the amount is $9,275,234. For long-term acute care facilities, the amount is $3,168,093. And the adjustment in the hospital provider fee, we estimate that to go back up in 2020. And the amount for that additional revenue coming in is $10,410,506. And the next 2 items are new items for fiscal year 2020, and that's FMAP adjustments in our budget. And those FMAP adjustments is for regular FMAP and for the enhanced FMAP related to peach care. And the regular FMAP is going from 67.62% to 67.30%. And the peach care, as previously mentioned, is going from 100% reimbursable to 88.52%. And the request for that amount is $64,626,676. The next item is health insurer fee moratorium. Providers would not have to pay that fee for this year, so it will be a reduction in our budget for this year as it relates to the health insurers fee moratorium, and that reduction is $34,400,000 $39,760 as it relates to health insurer fee moratorium. That concludes our benefits request for our budget as it relates to amended year fiscal year 2019 and fiscal year 2020. We will go next into our state health benefits plan. And within our state health benefits plan, you will see yes. And the reason you see yes is because those items, and like I said, is not state appropriated dollars. Those are just changes within our budget, which actually reflects either a adjustment in terms of adding to SHBP in terms of other funds or reducing other funds within the state health benefit budget. The first of those items reflect updated growth as it relates to state health benefit, and that is increasing that funding of $162,183,668 in the amended fiscal year, and $224,651,921 in fiscal year 2020 as it relates to state health benefit plan. The next item is to increase funds to add a new service to reflect enrollment growth for mental health parity for state health benefit plan. And actually that amount is also reflective in the growth number as it relates to the $162,183,668 and $224,651,921. You see the numbers the same because we rolled it into the growth number. The next item is to reduce funds to reflect savings related to renegotiated Medicare Advantage rates for those who are 65 and above as it relates to those premium adjustments that was in this year's calendar year plan. And that's a reduction of $41,975,000 for amended fiscal year 2019 and $126,362,000 in fiscal year 2020. The only new item for fiscal year 2020 that doesn't impact this amended year is for a adjustment in the percent of payroll that employers pay on behalf of the employees as it relates to state health benefit plan. That goes down at least 1% for fiscal year 2020, and that'll be a reduction of $32,218,604 as it relates to state health benefit plan, as it relates to an employer share that they pay on behalf of state employees. That concludes all the items for our budgetary requests for amended fiscal year and fiscal year 2020 as it relates to DCH.
Thank you, Lisa. We'll be happy to answer any questions and certainly want to recognize Chairman Parrish, who we saw when we were coming in, and Dr. Burke for their leadership as we've gone through the year, and thank you very much. And
Commissioner Andy Welch right here. Thank you for being here today. For you, I saw in the budget that there was a budget request for background checks, almost $500,000. First, could you explain the background checks that you're seeking? And the second, and maybe as a possible solution to that expenditure, with Senate Bill 336 last year, we authorized various agencies to utilize GBI's RAP-back program so that they were able to take a one-time fingerprint, have that retained so that checks could be made and you wouldn't have to do this on an annual basis, thereby saving the agency and those that may be contracted with the agency significant sums. Would that be an opportunity for the agency to save that $500,000?
so this is kind of the second part of RAP-back, follow-up from last year's legislation, and I think that that can absolutely be a part of the discussion. Lisa, you want to talk about the specific dollars and how we're thinking about using those? But it is a kind of the second phase of what we accomplished last year, and we can certainly have more discussions about how we might be able to streamline that moving forward. From a dollar figure, any additional thoughts on it?
In terms of the current item
Yep.
that's in the budget?
Yep.
The current item that's in the budget actually is for the background check at those long-term care facilities, and this is just to help us. I'm sorry. This is just to help us with staff to help make sure those background checks are done as it relates to Senate Bill 406 and sure it's implemented in terms of those checks at those facilities.
We'll be more than happy to have further discussion. Joe Hood is here, and I know Joe has worked closely with you on this in the past.
Senator Lucas.
Commissioner,
Yes, sir.
what is our reimbursement rate with Medicaid? For every dollar we put in, how much do we get back from the feds?
It's about,
It's the 66.30% that I.
66.33%. Let me ask you this. We right now are trying to deal with rural health and rural hospitals, keep them from closing. And we passed a bill that allowed up to $60 million to be donated by persons or corporations, and they get a tax break.
yes, sir.
If that is the case, can't we take that money that's being donated to those hospitals for those particular purposes, include that money, still give the corporations or the taxpayers the tax break, use that money with Medicaid and bring down almost 3 times the amount of money that we're doing now, and not have the problem we had, I say a year ago, we 60 million, and we end up having to refund folks their money back because we had a cap. To me, wouldn't that help us? About 14 years ago when I was in the House, we did basically the same thing with hospitals on their reimbursement rate by getting the money up and then turn around and bring the money down, and they got more money based on the figures.
It's something that we can look into. I don't have an answer for you right this minute because we need to just check on what type of money it is. I certainly understand your point. Can we use that money as match money to draw down federal funds? And we'll need to check on that, and we'll get an answer back to you.
Representative Knight.
Thank you, Mr. Chairman. 2 items, Commissioner. One is, this is a very significant part of our state budget that goes towards health care. And in order to make sure that we're protecting, state resources, our patients, our providers, such as pharmacists and all, what are some items as far as the oversight, how we can increase the oversight over the contractual provisions that you guys are administering on behalf of the state with our health insurance providers? Making that a little more transparent, maybe?
I think transparency is one. I think having ongoing discussions about what our contractual relationships are with our providers is another one on a more regular basis, not just during times of renewal, is another one. I think that the contracting process should be an ongoing dialogue throughout, and the state needs to be in the business of purchasing what we want, not buying what somebody wants to sell us. And so those are 2 very different things. And I think that we've been working with our providers, both on the state health benefit plan and as it relates to our big Medicaid providers, to come to the table and have ongoing dialogue about what are the performance indicators, what are the clinical outcomes that we're looking for, not just financial outcomes that we're looking for, so that we all can be on the same page of expectations. So I think it's communication, and that was one of our key pillars: communication, communication, communications, and then knowing that we're all in this together so that they understand the state has certain expectations as it relates to quality, not just quality of care, but quality of contract management that we provide, and we're looking at that. That's something that I've been there 2 years, has been a key issue for us, is looking at how we both hold contractors accountable, how they hold us accountable, but what is it that we want in contracts and how are we measuring that? So if you have some ideas, we'll be happy to have more discussion with you. If there's concrete suggestions you have, we'll come over and meet with you.
Transparency is a big issue, and certainly I think it's a follow-up. I'd spoken with several members recently in a car ride, but especially with the Medicaid. I have a provider who's provided an emergency service.
Yes.
And, because of documentation, was denied, payment on an emergency delivery of, a baby. But yet, after I think 2 appeal attempts, he was still turned down. So it seems to me that there's an issue of we're pushing down cost on providers when they're delivering health care versus, I think you were going at it from a quality of health care. I think that there's multiple angles that we need to look at.
So I think it's a great point, and one of the things that we're working internally on is if a service, so let's follow up on that, let's have an offline, because if a service was delivered and there's documentation that a service was delivered, we've really been pushing the department then to pay for that service. I look at it a little bit differently, that if somebody is charging John Doe for a service that was never delivered and you're trying, that's a fraudulent activity. If somebody's delivered a billable service and that care can be documented, then the department really needs to look closely at how we reimburse that.
I see 4 questions. We're going to cut them off right there, so we're already about 10 minutes behind. So Senator O'Rourke, your question.
Thank you, Mr. Chairman. Thanks, Commissioner. And Lisa, your capable assistant. Disturbing headline around the anthem, which covers state employees, health care coverage, that Wellstar services delivered from Wellstar are not going to be covered any longer by Anthem, Blue Cross Blue Shield. Where does the state stand in that discussion? It's alarming. It impacts God knows how many families, and it's a whole swath of Georgia that's served by Wellstar. So, and this isn't the first time that we've gone down this road with who's covered and who's not, and people pay their premiums and they buy into a construct that includes Wellstar providers, and now here we are teetering on the brink. Love to hear your wisdom about that, and I'm sure I'm speaking for a whole lot of state employee families.
So this is specific to the exchange. So under Blue Cross, Blue Shield, Anthem, and SHBP, it does not impact that network for SHBP members. This is primarily targeted towards the exchange. So one of the things that's a challenge is what we have oversight of is when it's an SHBP or an Advantage plan, but on the exchange, the state doesn't have a whole lot of authority, if any, to engage in those discussions. What we can do is encourage, but there's no contractual relationship that the department has as it relates to the exchange members. Even when we, yes, ma'am?
Well, just a follow-up. Isn't it true that all of our providers are impacted when you have a big swath of people that suddenly don't have coverage anymore from this exchange marketplace? They suddenly are uninsured when it comes to going to their own providers.
Yes, so, I mean, if you're
and that
absolutely
impacts everybody.
Excuse me, you're absolutely right, because in essence, a person who has coverage, who doesn't get coverage there, becomes in some regards uninsured. And so yes, it's a problem for the system. I don't know how, I wish I had more wisdom. I don't know how to address the issue for something that doesn't fall under the jurisdiction of the department, and yet this provider is a major provider for other services that our department does contract with, other than to try to bring them to the table and explain the challenges that this brings to the state and try to encourage. But from a very, looking at it from the very letter of what our responsibility is, and I know this is not a great answer, there's not a lot we can do, and it's very frustrating, even as it relates to when people do go in and out of network that are with SHBP. The role of the department is to hold its contractors available or accountable, and we contract with those TPAs. And so it is a challenge. I'm not discounting your point. It is a challenge for all of us.
Representative Jones.
Yes. Can you tell me how can physical therapy days in our health benefit plan be increased? Currently, members who have Blue Cross Blue Shield only gets 40 days, which is nowhere near enough for people with spinal cord injury, and there needs to be more than 40 days of physical therapy.
So I think going back to the SHBP plan, if you're talking about people that are covered under SHBP, we have to, and it's a challenge, we have to remember that any type of increased services potentially increases premiums. And so when you squeeze from one end, if we want more services, it's going to cost the plan more money. I don't think you would find any argument that increased services for individuals with a spinal cord injury are needed. And if there is an appetite for potentially looking at premiums and rate increases, that's how you fund the SHBP program. But it's a real balancing act of keeping premiums somewhat flat, which is what we've really tried to do for the last several years, versus increasing benefits and then looking at how you balance the plan. I think it's worth us, and again, if you'd like for us to come back over and talk about specifics, what we can do is share the costs of what that would cost to increase the amount of services and demonstrate how that would increase to the plan. And then if you all decide that that's something that is worthwhile from a cost standpoint, then we look at those things.
Representative Hawkins.
Thank you, Mr. Chairman. I'm going to defer my question due to the time limit here, but I do want to say publicly thank you for your work. Thank you for working with us, and thank you for representing Georgians that can't represent themselves with their health care issues. You do a great job. Thank you.
Thank you. Thank you very much. And it's a great team to work with. Thank you.
Representative Petrie.
Thank you, Mr. Chairman, and thank you, Commissioner, and Ms. Walker. Thank you for the fine work y'all do. Quick question, real quick. So we've got a $500,000 plus or minus in the supplemental and in the new 2020 budget for the fingerprinting. To make sure I understand that, is that for the new vendor that will be doing the fingerprinting, or is that for state employees that will be managing this in the state office?
This would be for state employees who will have oversight, making sure those facilities receive those background checks.
Okay. And so that's not for the entity that is going to actually be doing the live scans?
No.
Okay,
No,
thank you. Thank you.
Okay, that wraps it up. Commissioner, thank you so much for what
you,
you're
Mr.
doing.
Chairman.
You have a big job. Thank you very much.
Thank you all. Thank you, Mr. Chairman.
Rocking right along here. Hit that 3 button right there and turn me off there.
All right, blow it up.
They forgot theirs. Oh, Lisa, I just gave Cliff.
If all the providers will ease on out with DCH, we'll get started here. Commissioner Crittenden, welcome back to your department. Thank you for your job as Secretary of State during the time.
Thank you, sir.
You have our admiration and maybe pity might be another word toward it as well, but you did a great job over there, and we're glad to have you back in Human Services as well.
Thank you. I appreciate it.
Okay. Let me see if I can get some order here. Thank you, Representative Williams. I appreciate that. Missed your speech yesterday. I'm sorry I missed it. Thank you, Commissioner. You're on. Go right ahead.
Thank you. Good afternoon, Chairman England, Chairman Hill, and committee members. Thank you for this opportunity to come before you to discuss the governor's amended budget proposal for fiscal year 2019 and his proposal for fiscal year 2020 for the Department of Human Services. My name is Robin Crittenden, and I am the DHS Commissioner. Members of my executive leadership team are here with me today, and Interim Director Tom Rawlings is here with his team to present the Division of Family and Children's Services portion of the governor's recommendations. The Department of Human Services consists of the divisions of Child Support Services, Aging Services, and Family and Children's Services. Our vision is to build stronger families for a stronger Georgia. With each policy, program, and service we provide, we ask ourselves, does this help build stronger families and, as a result, a stronger Georgia? With that in mind, here's how we will use our resources to accomplish our goals, adhere to the laws governing our programs, and hold ourselves accountable to the public trust. DHS has about $1.7 billion allocated to protect and serve Georgia's vulnerable populations. Accounting for DHS and its attached entities, the total fiscal year 2019 budget allocation is $1.9 billion. Now, to turn to the recommendations that Governor Kemp released last week. Overall, for DHS, Governor Kemp is requesting an amended fiscal year 2019 budget of $807.7 million in state funds and $825.3 million in state funds for fiscal year 2020. This amount is $10.8 million in additional funds for DHS in the amended fiscal year 2019 budget and $28.4 million for fiscal year 2020. These include common changes or statewide adjustments included in all agency budget requests. I will discuss the DHS budget recommendations, and Interim Director Rawlings will address the DFAC's budget recommendations in a few moments. For the amended fiscal year 2019 budget, Governor Kemp is recommending two changes. First, $26,423 for statewide training for the Long-Term Care Ombudsman Program. This program seeks to improve the quality of life for seniors and adults with disabilities who live in long-term care facilities such as nursing homes or personal care homes. The program supports residents' wishes while working to resolve problems and provides advocacy and informal resolution of residents' concerns. Effective October 1, 2019, the federal government will reduce the number of complaint codes from 130 to 60. This training will enable the office to more uniformly record work related to complaints about facilities. The data is reported to both the state and federal governments. The Long-Term Care Ombudsman Program has a total of 51 paid workers and about 40 volunteers that work through nonprofits. Second, $153,745 for enhancements to the TRAIL system, which is the system our residential child care licensing unit uses to record information on facilities, process applications for licensure, and report on-site incidents more efficiently. This funding expands the system's capacity to support the work required by the Federal Family First Prevention Services Act of 2018, or Family First. Interim Director Rawlings will talk more about Family First during his presentation. For fiscal year 2020, here are the governor's recommendations. First, an increase of $1.8 million for Peach Care for Kids under Georgia Gateway. This adjustment reflects a reduction in the preliminary enhanced federal Medicaid assistance percentage, or FMAP, under the Affordable Care Act. Second, the transfer of $883,359 for TeamWorks billings to the Georgia Vocational Rehabilitation Agency, or GVRA, which aligns each agency's budget with projected expenditures. The governor's recommendations for fiscal year 2020 will also help DHS better serve vulnerable populations by providing resources to support older and disabled adults and ensure that vulnerable children and adults are safer. This includes $957,087 to add 12 adult protective services workers to help reduce caseloads. APS currently has 155 case managers. Adding 12 will take that number up to 167. The current worker to caseload ratio is 1 to 27. Adding 12 workers will lower the ratio to 1 to 25. The national standard is 1 to 15. Second, $366,752 to add 5 public guardianship workers to reduce caseloads. Our public guardianship office has 34 case managers. Adding 5 will take that number up to 39. The current worker to caseload ratio for PGO is 1 to 25. Adding 5 workers will lower the ratio to 1 to 22. The national standard is 1 to 20. Third, $945,955 to help reduce waiting lists for home-delivered meals. As of January 10th, approximately 2,700 people were on waiting lists for home-delivered meals. These additional funds would provide 129,299 meals, serving 515 more clients per year. Fourth, just under $1.9 million to fund 1,000 additional slots for home and community-based services, reducing the wait list for seniors seeking non-Medicaid services, including respite care, personal support, homemakers, adult daycare, and emergency response systems, such as Life Alert. Turning to the next slide, first, $338,802 to support Georgia's Aging and Disability Resource Connection, or ADRC. The ADRC is the no wrong door access to long-term services and supports. It is a system of partnering organizations dedicated to supporting individuals who are aging or living with a disability, as well as their family members. It provides information about long-term supports and services, which can be both publicly and privately financed. The recommendation includes a position of an options counselor and a position for a data analyst, both at new fringe rates and money for marketing the program. In addition, the governor is recommending a continuation of funding from the amended fiscal year 2019 budget to support the ongoing maintenance of the trail system for our residential child care licensing unit. This funding will also support adding a position for compliance monitoring. Specifically, $101,158 in additional funds for residential child care licensing to pay for ongoing maintenance of the trail system. Again, this system makes tracking facilities, processing applications for licensure, and reporting incidents more efficient, and keeps the public and referral sources informed on the performance of those facilities and programs. This system is key for Family First. Also, for our licensing unit, $69,331 in additional funds for a compliance officer in the residential child care licensing unit. As a reminder, residential child care licensing staff ensure that facilities and programs operate at acceptable levels as mandated by state statutes and by rules and regulations. An additional compliance monitor will allow RCCL to meet business standards for timely processing of complaint and incident reports. This will be extremely critical when Family First goes into effect. Finally, the governor is requesting the $883,359 that was moved from DHS administration that was noted earlier in the presentation be transferred to GVRA's administration budget. That completes the DHS portion of the governor's budget recommendations. Now, Interim Director Rawlings will speak to you about the DFAC's budget recommendations, and we will be glad to answer any of your questions after his presentation. Thank you.
I'd like to thank the former Secretary of State. Chairman Hill, Chairman England, members of the committee, ladies and gentlemen, I'm Tom Rawlings, Interim Director of DFACS, and with me today among my staff members most critical to working with you on these issues are Cliff O'Connor, who's my Chief Financial Officer, and Walter Jones, who is my Head of Legislative Matters. Our agency has two main tasks. One is to ensure that those Georgians who are needing assistance in moving from a state of dependency to a state of self-sufficiency for themselves and their families can get timely, accurate benefits. The second is keeping Georgia's children safe while respecting the rights of their families to care for their own children and respecting the rights of extended family members. When I was appointed to this position, I found a solid agency made up of very dedicated professionals. I am really building on the foundations that were laid by my predecessors, certainly under the last several administrations I've had the privilege of working with. And we continue to work with the foundation laid down by Bobby Cagle and Governor Deal especially, with the idea of improving our workforce, engaging with our communities across the state through our State of Hope program, and as I said, keeping child safety a priority. During the coming year or so, I want to add two areas of emphasis. One is to create a just culture in our organization, one in which we place a very high value on supporting our frontline staff and helping them do their best, one in which we address issues that come up, problems that come up systemically instead of blaming individual actors or individual employees, and in which we seek out and respond to the concerns that frontline staff bring to us and incorporate that feedback to improve our work. The other is to find ways that we can better use data which is often already available to the state, and automatically integrate that data, such as birth records, hospital behavioral health records and histories, Medicaid and public benefits records, corrections and community supervision history, to improve our ability to screen, to triage, and to respond to the 140,000 plus complaints of child abuse and neglect we receive each year. Let me mention a couple of things that in the past year our agency has, I think, shown and what they can do very good work. First of all, we rolled out the panic button this past year, late in the year. This is a device that helps improve our worker safety by ensuring that when our caseworkers go out into dangerous areas of the community, which they often do, that if they get into trouble, they can discreetly push a device that signals for help and that identifies where they are and sends assistance immediately. We launched our State of Hope community engagement program and engaged 60 different entities, different organizations, individuals, nonprofits, churches around the state who could come in and help us provide services in the community. And we were actually able to fund some of those with some of our dollars. Our effort, of course, being to take what we know as an agency about the needs of Georgia's families and engage with local communities to serve those needs. Of course, the Family First Prevention Services Act, as Commissioner Crittenden mentioned, passed early last year in February, passed the federal government, was signed into law by President Trump, and we have been working very hard to implement what we know is the most significant change in federal child welfare law and policy in the last 30 years. Our SNAP Works has gotten great national media coverage as we are helping our food stamp recipients find work, connect to employment, connect to skills. And we have, I think at the same time, it's really important to mention that after Hurricane Michael this past fall, our agency, I think we had about 50,000 applications for disaster food stamps. We were able to provide over $25 million in disaster funding. In doing that, we had the assistance of not only volunteers from our agency all over the state, but also volunteers from DPH, Department of Public Health, from Community Health, from other areas of the Department of Human Services who all came in to help us process those applications. Let me talk a little bit about where we are in terms of child welfare. The next slide you'll see that between July of 2013 and really this past summer, July of 2018, we had a very steady increase in the number of children in foster care up to close to 15,000. We instituted some priorities, especially what we call our pre-team method or project, in an effort to very safely reduce the number of children who are coming into foster care by ensuring we were exhausting family resources and also community resources before bringing those children into care. So I believe that we have, my hope is that we have peaked in the number of foster children and we'll be able to safely reduce those numbers as we go forward. I think on the next slide it's also important to mention that at any time we have about 1,400 children in the state who are free for adoption. We have made increasing adoptions a significant priority for the agency in the last 4 years. That is bearing fruit. We had about 800 children, less than 800 children adopted in 2015, and we were able to find successful homes, successful adoptive homes for over 1,200 children during this past year. And as you'll see, we are making some requests for funding regarding adoption as we move into this amended budget year in 2020. So let's step for a moment into the amended 19 budget request. The first one here you will see is for child welfare services to provide funds to work with our providers to help them get ready for the Family First Prevention Services Act. Some of y'all were able to hear a presentation I gave to a committee of the legislature this past fall. Commissioner Crittenden and I were here together. If you were not here, we have that PowerPoint. But essentially, many of our group home or congregate care providers are going to have to make significant changes to the way they do business in order to continue to receive federal matching funds for foster care. That's important to us and it's important to them. One of the things that a group home or congregate care provider can do is become a qualified residential treatment provider. One of the things that will require under the federal law is that they become accredited. So we will be using this budget request, $504,000, to help our providers get ready our congregate care providers get ready for this transition and change to the model. We know that we need their services. We know that we need certainly the services of providers who can give therapeutic assistance as well as residential care for our children. And so we're very much looking forward to working with the congregate care providers to make that transition. The second is to use $808,000 in existing funds to support retention initiatives for eligible relatives. I think the point here is that we will be, for FY amended 19, we are working to move some funds around so that we are increasing our ability to recruit and retain both foster care providers, but especially also relative caregivers. We want to keep children with relatives as much as possible. And then in our out-of-home care budget, as I noted earlier, we have slowed the rate of children coming into foster care. We have reduced those numbers, but at the same time, we do have growth in that program. Part of that is that we have a changing mix of children in care. We are tending to get a little bit more of an older crowd, older youth who need a little bit more care. The second part is that y'all were kind enough to give our foster care providers a per diem increase in the last couple of years, and for amended 19, we need to make sure that we are increasing the funds in the amount of 7.1%, really, or $9.8 million to cover that. While I'm on the subject of where our children are, I'm sure many of you want to know where the children in foster care are. So let me say that of our placements right now, about 11% are in congregate care placements. Of the remainder, it should be interesting to you to know that about a third are in what we call DFACS foster homes. Those are homes recruited, managed by the agency itself. About a third are in our private foster care provider homes, and those may be nonprofit or faith-based. I'm sure many of you know an organization that provides foster care for our children. And then one of the most surprising and I think exciting things for me is that over the past couple of years, we have increased the number of children in relative care from 19% to about 30%. And that's a significant increase. It means that we have these children in a safe place but with a relative under our supervision, but at the same time they're with someone they know and are probably much more likely to be placed close to their homes. So let me now turn to fiscal year 2020. As I mentioned earlier, we are making a significant effort to increase our adoption services. So Governor Kemp has generously recommended funds for a 4.2% growth in our adoption services in the amount of a little over $500,000. Much of this goes to providing adoption assistance and adoption incentives for those families who are willing to take in some of our special needs children. They receive these funds until the children are age 18. It is an important method to make sure that we don't abandon the family that is taking in a child and loving that child and giving that child a permanent home when that family is going to need additional services because of that child's either medical or perhaps emotional or developmental needs. The second on that one is simply a increase in the FMAP, the Federal Medicaid Assistance Percentage, of $145,000. One of the next slide will kind of show you a number of significant changes that we're actually very, very pleased to implement. The first is, as I said, we are implementing this Family First Prevention Services Act. This law will require us to significantly change how we bill, how we track services, how our providers bill us, how they invoice us, the data we track, and how we pay. So to make sure that we do that well, we actually have a 4-year plan It involves a request to y'all of $3 million each year. That'll be doubled with federal funds. And so in this year, for 2020, we've asked to have $3 million to improve our IT system so that we can get ready to implement this new law. To give you a very clear example, one of the things that we'll be able to pay for under federal funds now with 4E funding are prevention services designed to keep children out of foster care, but they have to be specialized services, they have to be certain type of services, and they have to be evidence-based. So we need to change our IT systems so that we are tracking who we're paying for, why we're able to pay for those services, which services we're paying for, and make sure that the provider is a properly accredited provider. We also have some other federal requirements to implement, such as the adoption and foster care reporting system rules that are laid down by the federal government, and also the comprehensive child welfare information system rules. The second is a little over $438,000 for our Family First implementation team. As I mentioned earlier, we have much work to do to implement this act. We have to do it well, so we need a project team with the personnel and the resources who can help us implement this necessary policy and make these necessary business changes. My intention is also to use this team's expertise towards implementing the more diverse service array for which the Family First Act gives us the opportunity to do. We'll be working with our experts and our providers to increase the availability of mental health, substance abuse, and evidence-based family support services to keep children from coming into care. And we're also going to be working to improve the ability of our system to provide therapeutic services for our children who are in foster care, but who have significant behavioral health issues or developmental disabilities that sometimes will cause them to act out and otherwise disrupt a placement. The next on the list is a request for a little over $860,000 for additional child care services. So we are able to tap into subsidized child care. We need the personnel and the infrastructure to be able to do that well. To do so, think about this. When we ask a family to take in a relative child, perhaps for a temporary time, or when we ask a family member to take in a foster child, they often are not prepared. These folks, to be able to take that child, may very well need child care. These funds are going to allow us to speed up the process of working with DECAL to get these families that child care. The SHINES data, our child welfare system data, indicates that over 40% of foster children who are age 5 and younger don't have child care in place. The quicker we can get that in place, the more likely we are to have a successful foster care placement, especially a relative foster care placement, and the less likely we are to have that placement disrupt. The next is provide funding for the new quality assurance and ongoing monitoring of child welfare support services providers in the amount of $427,000. As you can imagine, with an agency this large, we have a lot of different providers. We have to have the ability to monitor the quality of that work, to do quality assessment reviews, and to engage more proactively with those vendors and to ensure that we are getting the services that you, the taxpayers, and you, the legislature, authorized us to get. And so we're going to basically get one staff member for each $12 million in supportive services with these funds, or a total of 5 staff. And then finally on this slide, the closed case project pilot team. So many of you have heard of some of the projects we do, one of which is the cold case project, where we have been very successful in putting a team of attorneys and other experts to find permanency for children who have been stuck in the foster care system for a long time. This is a project that takes a little bit of a different approach. which is that we want to make sure the cases where we have intervened and closed the case, we need to go back and make sure that we have done quality work. It is a follow-up function so that we are doing quality assurance work. And for that, we're going to need $940,000. We're going to bring in staff to do that specifically, and certainly in our north and our metro districts starting, and see if we can't, in that way, ensure that the work we have done, the work we're doing today, once we leave that family, that we go back and check to make sure that work was effective. On the next slide, again, for 2020, we again will be using existing funds to support these retention initiatives. I think probably the best way to describe this budget request is that it's not a funding request, it is a priority statement that Governor Kemp has asked us to pursue this within our existing funds. And certainly one of the other big issues we have on the OFI side, on our Office of Family Independence, is increasing the funds so that we can, in the amount of $850,000 approximately, to hire 50 additional Medicaid eligibility staff for our aged, blind, and disabled population. As you heard in the DCH presentation, that's a little over 54%, I think, of the Medicaid state funds. So you can imagine it's a very big part of our work. We at DFACS are responsible for ensuring the eligibility. That is one area in which we have lagged a bit, and so we really need to boost those workers and boost that workforce. We have about 250,000 cases that we need to make sure we're getting those individuals, especially those who have these kind of disabilities, getting them Medicaid timely, renewing them timely, making sure we're handling that paperwork. And then 75% of the 75 will be matched at 75-25 with Medicaid administration funds. Also, again, maintaining our level of out-of-home care funding for 2020 with a 7.1% increase for a total cost of $9.8 million. And then, of course, we do have another federal FMAP, or Federal Medical Assistance Program adjustment of $116,435. I'm very excited that with Governor Kemp's recommendations, I think this budget will allow us to continue to make the improvements to this agency that we've been pursuing. That's our presentation, and I know that Commissioner Crittenden, and I would be glad to take your questions.
I'm sorry, but we're not going to have time. I'm sorry, we're about 20 minutes behind.
Okay.
And we've got two other speakers today, so if you all will ask your questions privately, I apologize, but we're just too far behind to finish up the day. So.
Thank you, Chairman Hill.
Three more speakers, I'm sorry. So just meet them outside and go ahead and ask your questions there. Thank you very much. Ladies and gentlemen, please leave the room quietly, and if you're outside and want to come in, come on in. If you'll leave quietly, we appreciate it.
So somebody used your name when you're talking to Elizabeth. Elizabeth thought they worked. Have you been in a conversation with anyone?
All right, Mr. Ward, it's good to see you, sir.
Good to see you,
The floor is yours. Go right ahead.
Thank you, Mr. Chairman, members. It's a pleasure to be here today. I'm grateful to the opportunity to talk to you about the Georgia Department of Corrections. But before I get started, I want to kind of introduce my staff, if that's okay. I have Ricky Meyer here with me today. He's the Assistant Commissioner for Facility Operations. I have Jay Sanders. He's the Assistant Commissioner for Inmate Services. I have Randy Sauls. He's the Assistant Commissioner for Health Services. And I have Alan Watson, who's the Assistant Commissioner for Administration and Finance, here with me also. And I have Peter Adams, who's his deputy. And I have Joan Heath is my PIO. She's somewhere in here. And I have Kristen McKinney, who's right next to me as the budget director. Today, sir, I would like to review the impact of criminal justice reform on the Georgia Department of Corrections, provide a quick overview of the agency, and followed by a review of the governor's recommendation, if you will allow. The first slide is the Georgia prison population from 2012 to 2018. First, I would like to review the status of the prison population. The population of offenders in a bed declined from 2012 to 2014. The governor, with the help of the General Assembly, enacted several CJ reforms measures that reduced the prison population. House Bill 1176, sentencing reform, addressed the adult offenders. House Bill 349 addressed juvenile offenders. Senate Bill 365 focused on re-entry. The population has begun to increase since the low in 2004. This can be attributed to inmates that have been convicted of violent crimes or sex offenses, resulting in longer sentences and length of stay. Current average length of sentence is a little bit over 12.3 years, which is the highest sentence length on record to date. 60% of our population of offenders are serving sentences of 15 years or more. Of the current population, 8,000 of our offenders are serving life sentences. Of those 8,000, a little bit over 1,512 are serving life without parole. Next slide, please. Our next slide is our Georgia prison commit slide. Criminal justice reform directly contributed to the decrease in inmate population due to accountability courts diverting low-level offenders away from incarceration. From 2009 to 2017, commitments dropped steadily, with 2017 being the lowest number of commitments since 1999. 2018 did see somewhat of a rebound in commitments. The largest increases were seen in our white male population and our white female population. And those convictions were around felony drug convictions and felony property crimes. We believe that increase is a result of opioid epidemic, but what we're doing now, we're dialing in on those numbers to make sure that that is accurate what we're talking about. Next slide, please. The next slide is going to show our violent versus nonviolent prison trends. CJ reform diverted many offenders into alternate sentencing options, which resulted in fewer nonviolent offenders entering the prison system. The percentage of violent offenders grew from 62% up to 69% in the 7-year period ending in 2018. 2 out of 3 offenders in the Georgia prison system were convicted of a crime of a violent or sexual nature. Many of these offenders have also been verified as validated gang members. GDC currently we house over 13,000 validated gang members. Of that, that's 25% of our population. As we continue our validation process, we believe that additional 20% of the population may have some sort of gang affiliation. Additionally, 20% of those convicted of a violent or sex crime have been diagnosed with some sort of mental health diagnosis. Next slide, please. The next slide is our recidivism rate since 1972. Recidivism rates have held steady over the last 10 to 15 years. We measure recidivism as the 3-year felony reconviction rate of released offenders. Next slide, please. The next slide I'm about to show you is our agency overview. That's kind of our internal dashboard, how we measure different measurements of how we do what we do. This is our monthly dashboard showing key statistics for the population. We presently have 88 secure facilities, which is a combination of state, county, and private institutions. Inmate breakdown, 69% of our inmate population is violent, with another 31% of that population being nonviolent. 19% of that population are what we call closed custody inmates, what we kind of consider that we have restricted movement on those individuals. They can't go outside and work or do things of that nature. The vast majority of our inmates are 71% in that medium range. That medium range is kind of deceiving somewhat because on the latter end of that medium spectrum, those individuals, just one disciplinary report from falling into that close security labor category. And we have a 10% minimum population. And that population, because of criminal justice reform, is kind of winning a little bit. Those low-line offenders are no longer coming to the prison system. That is that population that we use for our outside details, contract details, and also mobile construction that do a lot of great work out in the community. Next slide, please. Our next slide is our safe and secure facility slide. Our mission of public safety is non-negotiable. Part of our mission includes operating safe and secure facilities. To accomplish that, we must track certain activities. And this is the dashboard, this is the slide that we really track these activities. You'll see on the slide for mortality, you'll see suicides. Suicides have been increasing nationally, and this has reflected in the number of suicides in fiscal year 18 in the Georgia Department of Corrections. In response, GDC, in response to the spike in suicide in fiscal year 18, we hired a suicide prevention psychologist to enhance training to better identify risk offenders. As you can see so far this fiscal year, the decrease in suicides has been dramatic, but we really made an impact by hiring this psychologist. Contraband, that is our biggest area of concentration, which is contraband. Contraband has decreased slightly, but it's still a significant issue for the Georgia Department of Corrections. Cell phones continue to be our number one issue related to contraband. Drones are becoming the preferred delivery method for introducing contraband into our facilities. To help combat the introduction of contraband, GDC has increased portal security utilizing body scanners. One of the things we know on an average day, people don't realize the number of in and out we have at our facilities. On any given day, we have about 3,500 instances where our portal entries, back gates, and front gates can be breached by people coming in for deliveries, staff coming in to work, and different things of that nature. So we knew if we concentrate on our portal security, we can help prevent the introduction of contraband into our facilities. GDC has increased portal security utilizing body scanners. Perimeter security, we also increased our perimeter security by utilizing golf course style netting. Some of the things you see up there, the category is throwovers. That's literally when a person comes to our perimeter fence and throws contraband over the fence. We had to literally put netting all around our facilities to prevent that. And you'll see our throwover numbers have kind of increased. And it's going to sound crazy what I'm about to say. That really is promising to see our number of throwovers increase, because that's telling me that we're tightening down on our portal securities, so they have no other method of trying to get contraband in, but no other way but throwing it over the perimeter fence. And 9 times out of 10, when they do that, we catch them in the woods. We also have stadium-style lighting. If you go to one of our facilities in rural Georgia, it looks like a field of dream because it's lit up like a baseball field, trying to prevent those individuals from coming to throw that contraband over our fences. Also, we use thermal imaging. In rural areas, we got a lot of correction officers that really do a lot of hunting. That thermal imaging cameras come in handy when we catch those guys bringing that contraband. We also would like to take this opportunity to thank our local partners, our local sheriffs and our local PD, because they are the ones that help us when to have security stops or traffic stops. They have been trained to recognize when they see a bundle of loose leaf tobacco, tape, and 4 or 5 different cell phones. 9 times out of 10, they know they're delivering those packages to the local prison in that area, and they do an awesome job of helping us prevent that contraband from coming in. They are currently assisting in perimeter patrols and traffic stops. What we also do is we help out some of the local sheriff's offices because we hire part-time deputies to help patrol our perimeter, to help us prevent that contraband from coming in. So that's been a big plus for us also. Next slide. No, not next slide. Next is assaults. As I discussed previously, the population is getting more violent. Assaults are trending lower, but the assaults that occur are more violent because we have a more violent population. normally we would have a lock in a sock or just two guys having a fist fight straight up. But now, with the inflection of gangs in our prisons, we have more of your gangs type fighting, not one-on-one, but just mass inmates fighting each other. 48% of the inmates on staff assaults are committed by inmates with a mental health diagnosis. 54% of the inmates on staff assaults were committed by offenders that are validated gang members. In a continued effort to reduce assaults, we have developed specialized mental health treatment dorms. We have also developed a robust gang management program and increased access to programs to try to get those individuals involved in programs to try to prevent them from in that illegal activity or being involved in gangs. But we also, again, have improved our gang validation process so we can better manage those individuals. And the next category, that's inmate firefighters. That is a real positive story for the Georgia Department of Corrections. We have about 19 firefighter teams throughout the state in rural areas. In some cases, these are the only first responders to a lot of incidents of fires that happen in those rural communities. GDC also operates the only female correctional firefighter team in the nation, which is located at Lee Arundel State Prison. This service also improves the ISO ratings for local communities, resulting in reduced insurance rates for those local citizens in those small towns. These teams are also an integral part in the state emergency response of any natural disaster. If there's a hurricane, Hurricane Michael, any storm, any fires in North Georgia, if you look on those front lines, you're going to see a GDC firefighter right there alongside those other firefighters helping to defend this state. Next slide. The next slide is another feel-good slide. It's our education slide. I would also want to thank our partners in education. That would be Foothills Education Charter High School and the Technical Colleges of the Systems of Georgia. Total enrollment in academic and career technical courses equals 39,782 for the fiscal year 2018. That's a lot. Total enrollment, the department increased GEDs graduation by over 600 for a total of 3,017 for the year. This represents 28% of all GEDs awarded in the state of Georgia for fiscal year 2018. Career and technical graduation increased by 3,800 over fiscal year 2017. The number of high school diplomas awarded almost doubled to a total of 101. If you're a young offender that's 21 years or less, you have the opportunity not to get a GED, but an opportunity to get your high school diploma through Foothill Education. That is a big plus for those individuals. Next slide, please. Next, lastly, I would like to review the amended FY19 and the FY20 governor's recommendation. The following recommendations begin on page 144 and 1 through page 147 in your book, please, sir. Amended fiscal year 19, the recommendation includes an increase of $2.4 million for self-insurance premiums. The FY20 budget recommendations begin with an adjustment to the health care program. This includes a total of $14 million of funding to cover cost increases related to the new mental and dental health contract. And also the administrative program includes a transfer of just over $300,000 to DCS to support 9 reentry positions previously funded through a grant. Also on the offender management program, we're going to utilize existing funds to provide a 5% contract rate increase for all our county correctional facilities. That's a $1 per day increase that's going to total about $1.8 million, and that's going to be self-funded from programs that we move around internally. Next slide. Next is the governor's FY20 recommendation. $9.3 million in statewide changes for merit-based pay increase, employee share, retirement contributions, and insurance premiums, et cetera. The governor's total recommendation for fiscal year 20 is just a little bit under $20 million, a $20 million increase for the Georgia Department of Corrections. That concludes my presentation. I would like to answer any questions that you have at this time, if there's any questions.
Thank you, Mr. Chairman. Interim Commissioner Ward, thank you for being here and your staff. A couple of questions for you. First off, the Department of Audits did a study over the interim that discussed the plans that the Department of Corrections may have for bed capacity, expanding bed capacity, and made some recommendations concerning how to maybe better use facilities and allocate cost in anticipation that there would be population growth over the next foreseeable future. About 2.5% per year, I think, was the approximate rate of increase. So with that report, has the department looked into what plans should be implemented to expand bed capacity? And then also perhaps looking at the recommendation from the Department of Audits that suggests that we ought to reallocate our bed capacity and maybe utilize some of our CCIs better to accommodate those offenders that maybe are less violent.
Yes, and great question, sir. We have several shuttered facilities that we're looking at as part of that process to reopen. Also, we've got budgeted for funds to do the second phase of the Metro Reentry Facility here in Metro Atlanta. That's additional 350 beds. So we have a somewhat comprehensive plan to look at some of our shuttered facilities and see how quick we can reopen those facilities.
Okay. And then, Mr. Chairman, a follow-up?
Sure.
Secondarily, the addressing the mental health issues, to what extent is the department working with Augusta University or other institutions to provide more healthcare providers within the facilities to address both the suicide issue but also general mental health diagnosis on the entry level of and then appropriately allocate those individual inmates to the appropriate care that's needed for those with mental health conditions?
Yes, that's a great question also. We've designated 7 treatment options as far as dormitories to try to address those, from everything from dementia, traumatic stress, brain injuries, in those different categories. So we've seen a increase of diagnosing and providing for those individuals. So if I'm right, Randy, we have 7 treatment dorms that we've enacted at most of our level 5 mental health facilities that try to ease that mental health need there.
Senator O'Rourke.
Thank you so much, Mr. Chair. Appreciate the level of detail in your report. Thank you so much, Commissioner. I noticed on the education piece, there was no mention of college, and I think you all are engaged in maybe a pilot with doing some college classes behind bars with inmates. And I know that there's an agency here in Atlanta that has had 100% success with their students, inmates, with college courses of their going on to complete their sentences and returning to society. And I know you're starting it in the women's prison, I believe, right now, and that there are volunteer professors from across the state, maybe 60 on a waiting list for this one agency. So if you could just spend a minute, I think people would benefit from understanding the progress that you're making there.
Yes, we had partnership with Ashland University, Life University, also Jay, and also with New Orleans Theological Seminary to offer those degrees. Also, we have Georgia State University that's coming in and doing at Phillips State Prison. That's doing awesome. One of the good stories about it, our inmates our offenders have higher GPAs than some of the individuals that are on the street. And that has been a real big success. And also is a real help to us as far as the rising more violent population, getting these individuals in these courses. So it's been a real big help to the Georgia Department of Corrections. And we have Ashland University, Life University, Georgia State, and also New Orleans Theological Baptist Seminary, right, Jay? Common Good Atlanta, yes. Yes.
Yeah, I really applaud that work, and it's getting great results from my understanding, so forward.
Yes, yes.
Thank you.
Representative Jones.
Thank you, Mr. Chairman. I have 2 questions. I believe it was slide 6, page 6. I want to know about the smuggling to prisoners, staff providing, I should say, cell phones or drugs to prisoners. Has that number increased or decreased?
It fluctuates, and we do have an issue with our staff members bringing in contraband. You know, I'm not going to sugarcoat that one. One of the things I talked about, securing that portal entry, utilizing those body scanners, the same thing that our MA visitors or families are subjected to, we make sure that our staff go through the same process of being shaken down and being checked and make sure that contraband doesn't come in. But we have seen, and it spikes and ebb and flows, but we still have an issue with some of our staff bringing in contraband.
And my last question, can you tell me if there are plans to reopen some of the closed state facilities in the Departments of Corrections in rural Georgia?
Yes, we're looking at everything. That's one I was talking to Senator Apple's question. We'll, as part of the audit that came up from the Department of Audits, we looked at every shelter facility that we still have in our possession to see if it's fiscally sound to reopen those facilities. And I see Representative Bentley back there looking intently because she has a closed facility down in Taylor County that she constantly hits me up about.
Representative Dixon.
Thank you, Mr. Chairman. I'd like to thank the warden for the excellent work you've done. I've been visiting your prisons because I'm very interested in the reform, especially the criminal justice reform. And I just went to Arundel, and I did attend fire workers there. So I would just like to thank you for all the work that you're doing. And it's an eye-opener if you have not visited the women's and the men's prison, because I've been down to Jackson as well. So it's my goal to visit most of the prisons here just to see what's going on with the criminal justice reform. Thank you for a good job done that you're doing.
Thank you for saying that. You don't know how it impacts the staff to see visitors come and see what they do, because so many people underestimate or undervalue what our correction officers do on a day-to-day basis.
Representative Hughley.
Chairman, and thank you for your presentation. My question has to do, we've heard from several entities about female inmates, particularly when they're giving birth, being shackled. Is that what goes on, and if so, why?
Listen to me. We do not shackle pregnant females.
Well, why is that being said by providers and others?
We have searched high and low trying to dispel that myth. The Georgia Department of Correction, we do not shackle pregnant females.
So are they restrained some way?
No. During the intake process, if a female offender comes into our diagnostic process, which is Arundel State Prison up in Arundel, Georgia, if they come in that facility and we test all females to give pregnancy tests. If they're found out that they're pregnant, we transfer them where we have a Helms facility that's located right over here off of Constitution Avenue. I would want you to go over there and visit it and see what we do, because once we find out that they're pregnant, we start the neonatal process, making sure that we give them all the needs they want with prenatal care and everything. So we have a facility designed for those pregnant females, and it's on Constitution Avenue. Please go out and visit it.
I will. The other question was in regard to feminine hygiene products for prisoners. Do you have a cost? What does that cost you annually?
No, I do not. But one change that we did make about a month ago, we made it, normally we had a limit that on personal hygiene items we gave to female offenders, but a month ago we made a change that there is no limit on personal hygiene items for females. We make sure that it's accessible now in the common areas bathroom, so if they have an issue they can readily get it. So we started that practice about a month ago.
Thank
and
you.
I think if you went to Arundel, she should have saw that.
I did. As a matter of fact, I'm working with the chaplain there to help with some sororities in the church to bring in more
Okay.
products for the females at that prison.
Okay.
Thank you.
Thank you.
Representative Bruce.
Again, thank you for the work that you guys do. How many private prisons do we have?
We have 4.
And And how do they actually operate? Are they, I guess when you say private, it implies that the only way they're going to make money is if they have prisoners.
Okay, that's a great question. We have two providers in the state of Georgia. We have Core Civic, and we have the GEO Group. Core Civic operates 3 of our private facilities, and GEO operates 1. Each one of those facilities have what we call a private prison monitor. That's someone that's employed by the Georgia Department of Corrections that is housed in that facility to make sure that they are operating as the same as the Georgia Department of Corrections as far as policies and procedures. Their officers go through our basic correction officer training academy to get certified just like our officers. So basically run mirror to how we run our facilities.
So why do we need private prisons, I guess, and if they're operating exactly the same way we operate and their policies are the same, everything is the same, why do we need private prisons?
Private prisons provide a good niche for the Georgia Department of Corrections. If we have a little bit under 8,000 inmates in private prisons. If we brought all of those, if we absorbed all of those inmates back into the Georgia Department of Corrections, it would cost us about $1 billion because they would have to construct 4 facilities to house those individuals. It costs about $226 million to build a 2,000-bed facility. So they do initially, we don't bore the capital cost of building a facility like that. They bore all that cost. We don't bore the cost of paying salaries for officers. We don't bore the cost of retirement and things like that. So there's a niche for what we do and what we use the private prisons for.
Okay, last question. Are they using these prisoners to do contract work outside the prison?
I think we might have 1 or 2 facilities that have outside contract details, and what they do when they do the contract work, it has to be contract work with a county municipality. It can't be to a private vendor or a private citizen. And they have to make sure that contract covers the cost of that employee who supervises those inmates. And it has to be a approved contract. Any contract has to come through our legal department to make sure it's above board and legit.
Thank you.
Commissioner, that winds up all the questions, that were 1 question each, Reverend Jones. But you can stop him and get your question answered. Just stop him and catch him outside. We're 20 minutes behind. We got 2 more speakers, so we're going to cut him off right there. You had 1 question. We'll just stop him, and he'll answer your question on the side over here.
I come right over there right now.
Yeah, he'll get it for you. Okay. Thank you very much, Commissioner. Appreciate your report.
Yes, right here. Okay.
General Cardin, come on up. Change of command. I think it's this weekend, I believe. Give us a second and see if we can quiet them down a little bit for you. All you folks with prisons in your districts will be kind of quietly about asking your questions out there. Fella's got 13 in his district. He didn't even ask a question. Thank you all very much for your attention and your respect. General, we're glad to have you, sir.
Good afternoon, Mr. Chairman, members of the legislature. I'm Brigadier General Tom Cardin. I'm the incoming Adjutant General for the Georgia National Guard. It's an honor to be here with you today. I'll ask for your forgiveness up front. I'm about 75 hours back in the United States from about a 17-month tour in Europe. So in addition to being good to be home, it's an honor to be before you today to talk about an organization I've served for almost 33 years and love very much. So with that, we'll go to the next slide. Okay, this gives the Georgia Department of Defense's mission statements. It's pretty simple. We provide ready and relevant forces for our federal missions. In the event of emergency, we provide ready forces to the governor, and you all saw some of that in the recent hurricane recovery effort. Next slide. Here you'll see the chain of command. Obviously, the governor is our state commander-in-chief, and the President of the United States, obviously, for our federal missions, our commander-in-chief. General Engel, you'll see, is the Chief National Guard Bureau. And right now, your current Adjutant General is Major General Joe Girard. He and I have a change of command on Saturday. He's in school right now. I brought with me today Brigadier General Randall Simmons. Randall commands the Army National Guard, and Mr. Joe Ferrero, he essentially runs all of our state employee business. You'll see his picture there. We also have the Air National Guard. This morning I spent some time with the Secretary of the Air Force down in Warner Robins talking about J-Stars. So the Air National Guard, a big part of our mission. We also have the State Defense Force. If you have some of those folks in your district, you ought to thank them. They're not cheap, they're free. These folks give willingly and unselfishly of their time to their state to help their fellow man and woman in our families. So very, very proud of our organization. Next. This kind of shows how our Army Guard's laid out. We have 5 what we call brigades. You can think of them as major business units. We have an aviation unit stationed in Marietta, co-located with our headquarters. What's important to note about that is the 3rd largest non-attack rotary wing, i.e. helicopter flying unit in the Army National Guard. So we got a great aviation presence. Our 201st Regional Support Group is also stationed in Marietta. About 100 of those right now are in Iraq. And if you saw some recent pictures of the President's visit, you saw some of your Georgia Guardsmen standing next to the Commander-in-Chief. Our 78th Troop Command, also headquartered, co-located there at Clay National Guard Center in Marietta. 48th Brigade Combat Team, about 2,000 of which right now is serving in Afghanistan. Their headquarters down in Middle Georgia in Macon. And the 648th Maneuver Enhancement Brigade, their headquarters is over in Columbus. So essentially, those are where the headquarters are, but these units touch every community in the state, and I'll show you that in a future slide. The Air National Guard represents 2,820 thereabouts Air National Guardsmen. We have the 116th Air Control Wing, where I was this morning. We also have the 165th Airlift Wing out of Savannah. We have a few what we call geographically separated units in the Georgia Air National Guard. Again, these are just the headquarters. These units touch every district in the state. Georgia State Defense Force, again, total volunteer force. They do great work. This essentially gives the legislative piece of it, but the big thing is that I would tell you, they don't really cost us a lot, almost no money for what they do, and they give unselfishly of their time for their families here in Georgia. Statewide impact. We've deployed over 18,000 soldiers since 9/11 in the War on Terror, or Overseas Contingency Operations. Our Youth Challenge Academies. A lot of people look at this. There you go. The Youth Challenge Academy. What we're doing is trying to take business away from the people that were just talking to you in the Youth Challenge Academy. And when you look at this uniform, you don't think about military people running high schools. But the Youth Challenge Academy has graduated 16,535 graduates over 25 years. We've got people that come back from that program, doctors, lawyers, airline pilots, you name it. It's the best second chance program, and I'm a little bit biased, that I think I've ever had any part of, and just very, very proud of what they do. RAND study that I can provide you if you'd like to see it shows that you get about a 166% return on your investment. So when you spend $1 on the Youth Challenge program, you're changing lives, and you're doing, I think, it's a good expenditure of our taxpayers' dollars. Economic impact is pretty big. In the MilCon, we haven't done as much in 18, 8.3 million, but we do as much of that as we can because we've got to have good infrastructure to be able to do our business. Those are federal dollars. We do, with respect to drug seizures, you'll see a slide a little bit later on our counter-drug task force, $55 million related to seizures with that team. $480 million in federal funds. And you'll see in a later slide, our state budget runs somewhere around $12 million. So we have about a $480, $490 million in state and federal funds that come to the state. And my statisticians over here, I told them I wouldn't do math in public. It's never a good idea for an infantryman. But at the end of the day, it's somewhere around 900 or $890 million, I think, in economic impact to that $480 million in federal funds. My message to the federal budgeteers is $1 spent in Georgia is better than $1 spent anywhere else in the country. So we're going to try to continue to get those federal dollars and economic impact in our state. So we have $5.9 million in state income taxes just from the DOD payroll alone. The yellow areas show you where we have facilities. So essentially we have, if you don't have a facility in one of your counties, chances are you probably you're probably touching a county that has one. 2017, 2018 deployments, this is just letting you know where your constituents, what your constituents are doing for the country. The 116th Air Control Wing up in the top center they've been deployed continuously since 9/11. Not the same people, but those aircraft are out doing the business every day and have been since 9/11. I mentioned the 48th Brigade Combat Team out of Macon, about 2,000 soldiers in Afghanistan right now. Our aviation units have been both in Iraq and Kuwait in the last year. We have a unit that's associated with 3rd Infantry Division down at Fort Stewart. Recently, the 3rd Infantry Division headquarters deployed, and our Mission Command Post Operational, the MCPOD, deployed with the division. So you can't tell the difference these days between a reservist and an active duty soldier, and that's how well our training, and that's how well your citizens are doing to represent you, the state, and the nation. The 648th out of Columbus, they mobilized and deployed a group, and they went all over, essentially all over Jordan and Syria, Afghanistan, Kuwait, doing the business over there, what's called the Military Engagement Team. The 201st Regional Support Group down in the bottom left of your slide, they are currently deployed in Iraq with about 100 soldiers. Our Military Public Affairs Detachment also deployed, as well as the 165th Airlift Wing. So it's not your grandfather's National Guard. Our airmen and our soldiers are highly engaged both in federal missions and as recently as the recent hurricane in our state missions. The hurricane response for Matthew, 2,100 guardsmen, for Irma, 25, and for Michael, 1,600, and we threw a few pictures up there so you could see your constituents in action. This shows our population density. This is sort of the statistics behind the talking point with respect to every county in the state of Georgia being represented in the Georgia Army or Air National Guard. We're very, very proud of that. So some of your constituents, I guarantee you, are serving in our formation somewhere today. Next slide. We talked a little bit about the Counter-Drug Task Force, and this sort of breaks down that $55 million and how it came about, with $41+ million in drug seizures, over $9 million in currency, $660,000 in property, and then over $3 million in vehicle seizures. And that's keeping drugs out of the hands of our children, is keeping people out of the folks out of the facilities that you're paying for, the folks that briefed before us, and we're very, very proud of that team. State Partnership Program. We recently rolled out a partnership with Argentina. We've had one with Georgia for over the Republic of Georgia for over 25 years, and we recently started one with Argentina. So why do you care? I will tell you that when we're globally engaged with the missions that I just came off of, with the missions these gentlemen have been on, and the ones that I briefed earlier, that makes us relevant. And so when the federal authorities decide where they're going to allocate funds, they're going to allocate those funds to forces that are ready, that they're relevant, that they're capable, and that they're professional. And so when we tell you about state partnerships and we tell you about deployment, I know that's not necessarily a purely state equity, but that makes a good business case for us, and that's why we have such a robust federal budget, because that dollar spent here, we're going to make the business case every day that it's better than a dollar spent anywhere else in the 54 states and territories. Youth Challenge Academy, I talked about that earlier. I know Representative Williams has been a great advocate for us in that regard, because he has one down at Fort Stewart. 1,400 cadets have graduated the program, 733 have earned educational credentials, and that's just since 2017. We mentioned the big number earlier, almost 17,000 graduates since we started. It provides at-risk youth. You know, we are not taking your potential high school valedictorians and they're not coming to this program. These are kids that need a second chance. And this is a place for them to go to what I like to call our organization a leadership and potential factory. And the Youth Challenge specifically, I think, is a second chance factory to get them in the pipeline where they can reach their full potential. Those dollars that you spend on this program, I will tell you, they turn over hundreds and hundreds of times, and they absolutely change lives. I would encourage you, and we'll be glad to provide it to you. Go to a graduation. If you want to get inspired, go to a Youth Challenge graduation and see those families and see those young men and women get that GED and know that they're on a better path than they were on when they started 22 weeks beforehand. Next. Okay, so this lays out what's been socialized and endorsed by the current administration with respect to the budget. The office space for the Cyber Center is item number one, and I really, I'm just giving you the big ticket items here. Senator Hill, I'm trying to get you back on your timeline, sir.
So we just hit the big ticket items. So we've got the cyber center, the YCA positions, and you'll see how we have the cost share. Essentially, you're paying $1 and the feds are paying $3. So it's a 25-75. So it's a really good, I think, return on investment with respect to running that program. You'll see a whole slide in a second on the new Job Challenge Academy. It was a pilot program we've run for 3 years, funded by the Department of Labor. It was fully funded by them during the pilot, but now it's going into where we got to go to the 25-75 mode. Still just a great program, and I'll brief you on that in a second. The merit-based retention and recruitment incentives are there, and I think I saw Representative Bruce. We've talked about the former Lorenzo Benz campus many times, sir, in your district, and some of the land associated with that that we acquired has some dilapidated facilities that are left over, and these demolition dollars essentially cleans that up and makes us a great community partner. And I think what it'll eventually do is we'll have some property there that will perhaps provide some opportunity for us in the future should we have additional facility requirements. So we were glad to see that piece get endorsed by the administration, and then the renovation of the Fort Gordon YCA campus, the biggest bond piece that we have here, a little over $14 million. And I will tell you that we're just so very thankful that that's even being considered. We can't do in-processing at Fort Gordon right now. We're a little bit ashamed for families to see that place to start with. We might not get many students. It's very much in need of this, and we're very hopeful going forward that we'll be able to get that bond issue and get us a campus there that I think those kids and in our state deserves. So the Job Challenge Academy, I talked a little bit about this 5-month program, and essentially what it does is it takes a kid a little bit further past a select group, past Youth Challenge, and gives them vocational skills. And so, you know, Department of Labor came out and said, who wants to pilot this? And, you know, our culture in the Georgia National Guard, if the feds want to pilot something, if it's a one-legged sack race and they're going to pay for it, we're going to pilot it. So we didn't know how this thing would work, but we knew it was an investment in young people, so we did it, and it just puts kids on a little bit better path, more skill sets, and it puts them to work. And you'll see in a moment, we put several of them in the military, and we don't use that as to try to recruit every kid, but it's good that the military is an option among other career options that they might look at. So this kind of shows the stats in the big ticket here. 96 have earned college credit or a certificate, 51 enlisted to the military, 88% are placed by trade and a 90% placement rate. I would tell you that we probably don't have many vocational schools in the state that have those kind of stats to back up what they're doing. And if you look dollar for dollar, I don't know what they're doing because I'm not familiar with those agencies, but I think we'd be pretty competitive because of the 75-25 match. So, okay, next. Okay, so we got a great picture there from Dobbins. We got a C-130 in the background. And again, I'm glad to be home. I'm honored to be before you, and I'm prepared to take your questions. Yes, sir. We still have your uniform, sir. We'll be glad to take you back.
Thank you, Mr. Chairman, and thank you. I want to say what a great job you all do with the Youth Challenge Academy, but it baffles me that we don't have such a program in Columbus, in Fort Benning, the home of the infantry.
We just opened up a third campus in our defense, and we would certainly I will tell you, just, you know, I grew up on a peanut farm in South Georgia, and the GI Bill is the reason I'm standing here today. I will tell you that when we offered those young men and women an opportunity to climb out of the situation that they're in, where, you know, we will take every kid from Columbus we can get, we'll put them in one of those other campuses. If we can get one in Columbus, we'll absolutely do it. But I'm a fan, and I'm glad you are. Thank you.
Man from Fort Stewart, Representative Williams.
Hooah.
Hooah. Thank you, Chairman. I guarantee you 50 miles, many military posts, and they don't know what hooah means, but okay. Thank you first, and we're looking forward to working with you. We're going to miss General Gerard, for the job he's done.
Yes, sir.
But to make sure that the Youth Challenge, the Job Challenge program at Fort Stewart stays around is just a great opportunity. I think your unsung heroes, and also Fort Stewart last year certainly had the #1 director in the United States.
Absolutely.
Dr. Lotson down there. So it's a great place to be, and you do wonderful. The return on investment is unbelievable. And I think eventually, even though they are a little less than Fort Stewart, Benning will get a facility, because there's one thing for sure, we have a lot of need in this state. Thank you for what you do.
Well, I appreciate what you said about General Gerard, and just briefly, I'll tell you that we have our change of command on Saturday. I hope those of you who are inclined to come will do so, and thank Major General Gerard. There's two things I told the governor when he selected me or interviewed me for this job. Is number one, if I was him, I would shred Joe Gerard's passport and not let him go to Europe. And the second thing is whoever you pick is going to work in Major General Gerard's shadow for a long time, and it's just been my honor to work for him. So I hope you will take the opportunity to thank Major General Gerard for what he's done for the state and nation. He's a great American, no doubt about it.
Senator Kirk.
And General, isn't it true that that peanut farm that you grew up on was in Americus in Sumter County?
Yes, sir. Yes, sir.
I just wanted to point that out as your. And by the way, Senator Sims is in District 13. By the way, but Senator Sims and then Representative Chokus too. We just want to thank you for your service. You've done a great job, and I appreciate all the work you've done over the years and the young men and women that you've inspired.
Sir, I'm honored to be here. Thank you very much for those comments, and I never forget where I came from.
Well, General Cardin, I think you're off to a good start. You wowed them and leave them wanting more. So thank you very much.
Yes, sir.
Good luck on Saturday.
Thank you all very, very much. It was an honor to be here. Have a great day.
Thank you.
Sir, if I may, Mr. Chairman, just so everybody knows, as soon as I take command, I leave for 5 weeks. I have to go to a school to
Charm
be
school.
ready to operate at this level. And Randall Simmons will be in the follow-on hearings until I get back in March.
Right. Okay. You didn't hear what I said. They call it Charm School. All right, Mr. Beck. We're at the end of the. We're gonna make it. Jim Beck's been around a long time. We both have, haven't we, Jim?
Hey, Mr. Chairman.
Hey, good to have you. Thank you. Good to see you again. All right, y'all, we're nearing the end here, so y'all give me your attention, please. Thank you.
Good afternoon, Chairman England, Chairman Hill. Members, thank you so much for letting me be here. My name is Jim Beck. For those of you that I don't know, I'm the recently elected Commissioner of Insurance and Fire Safety, and it's a delight to be with you today. We are all rightly proud of Georgia's 6-year track record as being the best state to do business in. I want to take this opportunity to thank you for the role that each of you have played in that ranking. I walked by the Capitol steps, the North Steps on the way in here, and saw a big sign that talked about Georgia Speaks Business. Well, the reason Georgia Speaks Business is because of the partnership with members of this legislature and Governor Deal, our great former governor. So thank you for your role that you've played in the tremendous success that my recently graduated student, who's fully employed, knock on wood, now enjoys. So thank you so much. Having been in and around the insurance business for 39 years, I often say that insurance is the heartbeat of the free enterprise system. Nothing of economic significance can be achieved without the risk transfer and the risk sharing that comes with insurance. The insurance department is comprised of 7 divisions that has a total of 196 employees. The Insurance Financial Oversight Division licenses 1,600 insurance companies, analyzes 74 domestic insurance companies' quarterly and annual statements for solvency assessment. The Insurance Product Review Division reviews over 10,065 rate and form filings. The staff does an amazing job, but they do all that with just 14 people, which is pretty interesting, and we'll show. I brought one slide, so we'll show you that here in a minute and let you see how we compare to our neighbors. After the election, I met with a number of representatives of the insurance industry. Many of them are more familiar to you than I am. I see Emily Bagwell and Bobby Potter and Mark Tilkin and Stacy Freeman. There may be others in the room that I have missed, but I met with them and sort of wanted to hear their concerns. One of the things that I hear from them is that Georgia lags behind other states in insurance oversight. And this would be where the slide would come in. Chad DeBella is the budget officer. So you can see on spending on a per capita basis that Georgia is the lowest in spending on a per capita basis for insurance oversight. And you may say, well, what's the problem? Well, the problem is that insurance companies like to innovate. They want to bring new products to market. And it's difficult for them to take that to a state that is so thinly staffed and have the staff have the capacity and the bandwidth to understand that. New products like, does your credit impact you? Do you live near an art gallery or a liquor store? That's actually one of the things that some companies are using, rightly or wrongly. We have to have the staff to understand that because we simply can't get into the numbers as quickly as they can. So we need some additional assistance, and the governor has helped us with our request, putting in $1.1 million in state funds, which we're appreciative of. But if you look at all these states and you see that we lag behind them, it is, to me, a little bit beyond comprehension that Georgia is the 8th most populous state in the nation and that Louisiana and West Virginia outperform us in terms of investing in speed to market for products. The Consumer Services section of our department averages 10,700 customers' complaints that we help inquire on their behalf each year. The request for assistance on automobile and property insurance has remained fairly manageable. The investigators in the property and casualty section carry a caseload of 68. Contrast that to the health insurance and managed care cases, along with life and health, where the same load of investigators carries 111 cases. It's because the cases, as you would know from your own constituent work, cases involving health insurance are long and complicated. Very rarely are people fighting over one thing. It's usually a series of things that causes service to be denied or causes some claim payment to be denied. Frankly, we need to do more on behalf of our providers, our physicians. We need to be in a position as a department to advocate to make sure that they are treated correctly. Georgia has a prompt pay law. It's never been audited. As a matter of fact, it's self-reported by some of the insurance companies. You know, surprisingly, they never report that they have failed to miss the deadlines, the mark. And I can tell you from talking to providers that some of those need to be looked at, and that involves resources. Our premium tax division collects $1,111 million in premium taxes every year. $505 million goes to state, $506 million goes to county and local governments. Candidly, we believe that some surplus lines carriers are not paying their share of insurance, premium tax. The reason for that is we audit everybody who reports. We don't have the capacity to audit people who should be reporting and are not reporting. So it'd be like telling to the IRS, you'll never get audited if you never send in a tax report. Well, that doesn't make any sense. And so we need to make sure that those doing business in our state in the surplus lines and excess markets understand that we're watching. Florida has had a very aggressive program, collected quite a lot of money that was just sort of not being paid. We also asked to help this, we asked Governor Kemp to put $34,580 in the budget to help us staff temporarily audits. That doesn't address the surplus lines, but it addresses the backlog in auditing those that are filing, and he actually honored that request. A sub-program of insurance regulation is the Special Fraud Fund, the Special Fraud Unit. The unit is made up of 18 employees whose sole mission is to fight insurance fraud in the state. This is paid for by the insurance industry through an assessment. Obviously, all money comes from the customer. But the insurance industry has been supportive over the years of us beefing up that fraud fund. There is state money involved for about 90 days. The money is allocated, and then the minute we get it, their bills are sent out, all the companies settle up, and usually the money is fully back in the Treasury in about 90 days. So it's a pretty quick pass-through. Insurance companies have not only supported the fraud fund, but they've supported continuing expansion of the fraud fund. One of the areas where we think we see a lot of fraud going unchecked has to do with medical expenses around automobile insurance. You know, there's not a lot of money in minimum limit coverage, but it adds up if folks are not accessing that money properly and billing for things like tests with machines that they don't have in their offices. And so the SIU units, Special Investigative Units of various departments, of various companies do a good job, but clearly there are things the state can do that a private carrier cannot do. And I need your help in making sure that we're not allowing anyone to game the system that is already strained to the breaking point when it comes to health care and when it comes to, frankly, auto insurance premiums especially. The department's enforcement program houses the legal division. Legal division provides legal assistance to all department programs and initiates legal proceedings to enforce Georgia law. You may have been given, when you walked in, a letter from the Georgia State Firefighters Association. The Georgia State Firefighters Association is here to support our efforts to request full funding, and at the appropriate time in the subcommittee we'll talk about that, full funding of our fire safety division. The State Fire Marshal's Office includes divisions dedicated to building inspection, plan review, hazardous materials regulation, boiler, elevator, carnival ride inspections, arson investigations, manufactured housing inspection, fire safety education, and we, I'm told, even have to inspect some of these escape rooms that you've seen. You know, there was a death in Poland recently when an escape room caught fire. Currently, they perform over 1 million inspections for 1 million square feet of property around our state. From schools to nursing homes, Georgians count on the State Fire Marshal's Office to do our part of keeping buildings safe and up to code. And let me tell you how I view those inspections. That's not just a box that you have to check. The reason we inspect those buildings is because the firefighters, the men and women, run into those buildings counting on them being engineered in a way that meets the code. In other words, when they go through an apartment that they know is a few years old, they count on the firewall being up to code and holding for the 90-minute rating that is typically required in most cases. So this is not just a checkbox. This is life or death for the men and women of our fire service. And so that's why we need to be able to catch up on some of these inspections. As we look forward, we want to make sure the department is fulfilling its mandate from the legislature. In FY 2018, 37% of the safety inspections mandated by law were covered. 70, do the math, the remainder was not. That consists of boilers, elevators, amusement, carnival rides, and other types of amusements. The projection for FY 2019 is that only 19% of inspections that are required by law will be conducted. Due to the inability to complete all inspections, we estimate we lose about $3 million in revenue, to say nothing of the life and health safety concerns. Frankly, what keeps me up at night is wondering if some child is going to perish on a carnival ride that we didn't inspect. That's what keeps me up at night. Because that is, to me, as a father of an only child, I can't imagine that loss. Increasing staff to allow for inspections to be complete would have costs associated with it, but obviously there'd be some revenue. And Mr. Chairman, I'm coming to the end, so thank you for your patience with me as a newbie. During FY 2018, 32% of building inspections took more than 30 days, and that trend is worsening in 2019. We're building more, which is a good thing if you've got plan review and inspections capacity to meet these needs. Finally, I mentioned the industrial loan program. It's responsible for licensing, regulation, examination of all Georgia's 920 industrial loan lenders that make loans of under $3,000 or less. Oftentimes people say, well, why isn't that at banking? Walk into an industrial lender and then walk into a bank, and you'll see that the business models are very, very different between the two. In my first week in office, I began implementing some commitments I made during my campaign, what I call Day One Promises. This involved taking some actions to promote transparency. Right now on the department website, you can compare complaint ratios from company to company. We've collected that data for years, but it's never been made public. It now is public. You can compare before you buy. The other thing that we have done is we have required that that the rate comparisons be updated before a company can submit a filing for review. We have some sort of generic descriptions of the average driver, and you can do some comparisons there. We've also made people available to go out and meet with consumers in every corner of the state. People living outside of 285, as you well know, they pay taxes too, they deserve services too, and we want to make sure that, especially in some of these health cases where you're talking about very difficult and personal things at times, if a constituent wants to meet with an investigator face-to-face, we should be able to accommodate that. We continue to focus on these and other initiatives to help our consumers, protect our consumers, and importantly, to make the insurance marketplace vibrant and to help the insurance marketplace grow. And we, like you, want to make sure that we are a good place to do business. Then with that, Mr. Chairman, I've completed my remarks, and I'll be, if you want to haze me now, I guess this would be the appropriate time. So.
All right, thank you, sir. I don't see a question. Any questions from Mr. Beck?
Thank you for your patience, and thank you for your service.
Thank you very much. Appreciate it. Okay. Ladies and gentlemen, we get started at 8 in the morning, so bright and early. Bring you coffee, and we'll get started. Got a full half a day tomorrow.